Welcome back to Ask a Scientist. My name is Dr. Jamal. I'm a scientist and college professor, and today I'm going to be answering your science questions. Let's do it. Today's question is, can men get breast cancer? And the short answer is yes. Yes, they can, even though it's rare. But how rare is it? And how do you know if you're one of the unlucky few who can get it? And if you are, what can you do about it? Well, let's find out. According to the American Cancer Society, 1% of breast cancer patients are male. That might seem like a small number, but there are about 2.5 million cases of breast cancer every year. These are new cases. So you can imagine that the male proportion of that is a lot. So who is affected? Why? And what can you do about it? Well, most of the people that are diagnosed are in their 60s and 70s. So it definitely shows up later in life. Another common factor, just like in female breast cancer, these patients have mutations in their DNA. And this is usually in the BRCA1 and BRCA2 genes. These are the most common mutations in breast cancer. And lastly, some males who have breast cancer have elevated levels of estrogen. This is the female hormone that's usually pretty low in males. When it gets elevated, for example, in case of liver problems in males, this seems to increase the chances of males getting breast cancer. Those are the three most common factors that we've seen in males with breast cancer: old age, elevated levels of estrogen, and mutations. That being said, the best way to prevent this cancer is to catch it as early as possible. So whenever you notice any signs in your breast area, such as lumps, changes in your nipples, such as them getting bigger or harder, make sure that you talk to a doctor. It might be nothing, but it might also change your life. You never know. We can also do genetic testing to detect mutations, but not all mutations translate into cancer. I really don't want to scare you guys. I just want you to be informed and know what's going on, know the chances of getting this type of cancer, and know what to do to be prepared. But this was a great and important question, so thank you for asking it. If you have any more science questions, put them in the comments below and I'll cover them in my next videos. And be sure to subscribe so that you don't miss it. Other than that, guys, I will see you in the next one. Bye-bye.